The following is a sample from the New York Open Center's podcast series. You can see our website for full program ordering details.
My name is Aurora Ocampo. I'm an RN, clinical nurse specialist for the Beth Israel Continuum Center for Health and Healing. It's right 2 blocks from here in 5th Avenue. We have the Center for Health and Healing, where we practice both the Western and the Eastern. And that's why we call it integrative medicine, because they put them together. Right? So we have a practice there of regular doctors who does also holistic modalities, Eastern modalities. And, so I'm there. I'm one of the nurses. We have a nurse practitioner who does the basic medical thing, and I do the fun stuff. I do biofeedback, I do aromatherapy, I do Reiki, I know some of you are familiar with that, craniosacral, and hypnotherapy. I have a card here, actually. They call this a card, but that describes, I should have brought for the center, but I never remember. Here, if you want to pick up and you can look up to it. Okay, give you a few so you can pass it around. And I have brought a little show and tell here. This is actually an introduction to the series of session, a 2-hour series, 5, starting next month. 5 2-hour series that hopefully you'll have, not because there's so much information in aromatherapy. So it's like an introduction so that you can safely practice it, apply, for your self-care. So that's what the aim for this. And I'll give you a little bit of what the series would be like. And hopefully I'll try some of the oils here. The insurance, I practice. I have a private practice. But it's a fee for service. So they pay me first and then reimbursement. They ask for reimbursement from the insurance company. And how do they do that? Well, it depends on your type of coverage that you have. It depends on the diagnosis. Because I bill my care through what's called biofeedback, which is really not alternative. It's a mainstream now, because you can see biofeedback for pain management, for overall healing, cardiac. So what I do first when somebody calls me is that I tell them what kind of insurance. Call your insurance company. I give them a code and ask them if they cover your insurance, high blood pressure. So depending on and more, like I'm shocked that sometimes, I thought that they will not be covered. And later on I found out from the patient that they got covered. So we're getting there, slow but sure. But most of the doctors there accept insurance, different insurance. So it's a regular clinic. But, it's special because we have other things. We have acupuncture, nutrition, sports medicine, massage therapy. And even the doctors, the regular doctors, supposed to be regular doctors, they also practice acupuncture, Chinese medicine, hypnotherapy. So they also practice that. But if the patients are really very, very stressed and in pain, they usually refer them to me. And for an hour, I try to. And this is, aromatherapy really is the very powerful part of my practice. Because if not, then I need more than an hour to quiet down somebody or relax somebody. With aromatherapy, it brings them down a little bit faster so that at least by the end of the hour, they'll be totally relaxed. And most of them are. There's few patients who fight it. And because relaxing, you become vulnerable, and some can't handle that in the beginning. So, but now, when they feel it, the next visits becomes a little bit better. But most of the patients really are. So, what do we use? Well, mostly, even though they're coming in for high blood pressure, for pain management, I know that in the Open Center brochure, which I wrote a little bit, I edited it, I said that 80%, and this is from the literature, 80% of all medical condition is linked to stress. So that I do stress management no matter what the diagnosis, no matter what they're coming from, because as soon as they calm down, guess what happens is a lot of our body's natural healing hormones, endorphin, I know you heard, I'm going to pick 3. I tell my patient 3 superstar healing hormones, because most people have heard about it. Is endorphin, right? A happy hormone. It's a natural morphine, so that it's for pain management. Then you have serotonin. Everybody have heard of that for sleep, right? And when you're sleeping, good, restful, high quality sleep, is that your body is repairing. So if your sleep is not restful and kind of like the mind is still going, right? You wake up. How many of you here? Well, you don't have to raise your hand. It's a rhetorical question. How many really you wake up and you still feel tired, right? I'm so tired. I have 10 hours sleep and I'm still tired, because the mind don't stop when you're sleeping. So we can't quiet it down completely. You have to just maybe turn it down a notch or 2.
That was a sample from the New York Open Center's podcast series. You can see the full program ordering details at our website, opencenter.org.